Welcome. This is the Omdena local chapter in New Orleans, and we did a breast cancer detection and drug discovery using bioinformatics. The largest problem here is that in 2020, 2.3 million women globally was diagnosed with breast cancer. And out of those 2.3 million women, 685,000 of them uh, uh, is a part of the mortality. Um, I'm pretty sure that the more women that are diagnosed with breast cancer, the more would be the more that are tested, you will see that a lot more women have breast cancer than the ones that have been officially diagnosed. There are also more lost disability adjusted life years by women to breast cancer globally than any other type of cancer. So breast cancer is the most common cancer that you probably would encounter. Breast cancer occurs in pretty much every country in the world where there are women at the age after puberty, but with increasing rates in later life. So later on in a woman's life, probably between the mid 30s to 50s, they will encounter possible breast mass, which will lead to breast cancer. Also, breast cancer mortality rates changed a little from the 1930s through to the 1970s. Improvements in survival, which is good, began in the 80s. In countries with early detection programs, the most people that were able to be saved were the ones that had early detection in these particular areas. So trying to eradicate these breast cancers through non-invasive procedures. To me, chemotherapy is an invasive procedure. You want to be able to target the particular cells that are cancer producing. So we don't want to target the cells that the women are a person needs per se. Normally, when chemo is introduced into the regimen for a patient, they tend to lose hair, and it's just not the most efficient way, but I guess it is one of the only ways that we have. So that's why we're doing this project. We're trying to figure out better ways to detect it and better medications that we can use to try to eradicate this particular disease. The objective here, our goal is to determine the best early detection, which I mentioned earlier. The best early detection methods for breast cancer and to determine the best enzyme for the drug therapy based on the cancer type. So each breast cancer type has a better enzyme that is able to target that particular cell, that particular breast cancer type. Once the enzyme is determined based on the cancer type, then we want to determine the best active enzyme to develop the best medication for this breast cancer type. And this is how we did it. It was a 8-week long project. It wasn't difficult, but it was intriguing to say the least. So this is how we did it. We did data collection for tabular data, imaging data, and the enzymes for the drug discovery on the data collection portion. Data cleansing, we learned different techniques for combining image masks with multiple tumors, and we also developed a team for it. Also, the model creating. We began model building to determine the accuracy for each model. And finally, we have a dashboard deployed for the breast cancer detection, image segmentation, and a drug discovery with the particular enzyme of choosing. So technical lesson one, to understand the different libraries. This is something that we did. What did we learn? A lot of the collaborators did learn that breast cancer is something that we can look into in coding. with Omdena, in the help of all of their local leads, we're able to develop a program that we can involve all different aspects of issues that we're having in the world. So in the medical field, this is one of the issues that we're having, and it's breast cancer, and we're able to incorporate that within our project. We used different libraries, things that we were able to try to understand for model building, for image segmentation, and for normal detection tabular data, which is detection that it does not necessarily involve deep learning or anything like that. That's what I would consider it. This is basically just normal tabular data, which would be the patient lab data. Technical lesson 2, steps to follow when collecting data, which includes determining integrity of the data, try to locate most unique data as possible while ensuring, again, the integrity of the data, and incorporate all necessary data. Project management, as much as was possible, we tried to parallelize the tasks. So we want everyone to work in parallel, which the team, we decided to do that within the first couple of weeks. The first week was just to get a feel for everyone, to see how everyone was going to work. And after that, we was able to devote time to planning EDA and pre-processing procedures. Also, the lesson, diversity of the skills, ideas, planning, decision-making, self-evaluation, and vision makes a positive impact on the project, and it did. There were some people that was more in tune with the project per se. There was even someone that had someone in their family that was recently in this situation with breast cancer. So they was even more in tune with the project. And you don't necessarily have to have that particular thing happen, but I mean, you want to be able to involve yourself in the project as much as possible. The results, the detection of the lab results was in the 90 percentile. The image segmentation results was in the 90 percentile, and the enzyme model was in the 47 percentile, which we wasn't necessarily expecting for the enzyme model to be much higher than that, based off of the information that we was able to gather. And it's a trial and error when it comes to creating medications and using enzymes. We're just trying to find the best one that will suit this particular breast cancer type. And here are some of the drug discovery results. We got the 51% on this particular drug model. Like I was saying, it's not going to be as high, but in the percentile, previously it was mostly in the 47 percentile. This was in about the 51.3 percentile. And here are some image results. We can determine which one is malignant and which one is benign. You can clearly see here that this is a malignant tumor mask. This would typically be a benign tumor mask. So you can pretty much see how our predictions came out based off of the tumor. This is a benign tumor. And the actual mask, and this is what the prediction was of the mask. It didn't give the entire prediction, but you can clearly see the outline of it. Also, here's the classification model. We had this one was 97.3%, which is pretty good. I would like to do more on this project to see how far we can get with it, if we can actually do something a bit more groundbreaking. In future work, we want to collect MRI data. That's what we was having an issue with. That was one of the issues, that we could not get a partner that had MRI data, and we wanted to possibly use that data since it would have been more unique to this particular project. We want to fine-tune the detection models. We also want to fine-tune the drug discovery and field test models for eradicating breast cancer, which is also involved into fine-tune the drug discovery data. I am the chapter lead, David Frank. I want to thank you, La Pa Sit Avec Vous. That is just to say thank you in French. My French is not that good, but I tried. I will be trying to learn a little French in the next few years. And I want to thank everyone that was involved in this project. You all were a wonderful, wonderful part of this project. I really appreciate everyone. And I just want to say thank you again. I am a bit late on it. I had some issues at home, but trying to get this done for everyone so that this project can be out there. Thank you.